Hello, this is RxTI Talks, and I'm Adam Chassie. We spoke earlier with Dr. Diana Anderson, president of DAC Patient Recruitment Services. Diana shared some very specific insights on the state of patient recruitment today. Let's take a look.
DAC has been around now for almost 20 years in the industry and actually started out as a site management company with a very strong focus on working with sites, and came to discover after about 10 years that primarily much of what we were doing as an SMO was actually helping sites with patient recruitment services. So about 10 years ago we changed our emphasis completely on patient recruitment and retention. Really became globally focused probably easily 5 years ago, and a year ago the company was acquired by Imperial Clinical Research Support Services, which is a company that's been around about 60 years and provided back-end support and a number of services such as print and so forth to the industry for many years. And they found themselves really looking at opportunities to expand their patient recruitment repertoire. So that's been a great fit for the company, and it's allowed us to expand our global capabilities. Having been at this for almost 20 years and it being a pretty challenging area within the field, it's really been we have new challenges and new solutions every day, so to speak, and certainly have seen things become so much more sophisticated, so much more expertise required. And if you think back at even only 5-7 years ago, if you can imagine that we weren't even required to submit patient-facing materials to an IRB. Now, of course, that's certainly a high-level requirement. We wouldn't even think that that wouldn't be required for ethics and IRBs. And now we're seeing such advancement in areas that, from the global perspective, just take translation services. One of the elements of our new company is we have our own translations team in-house, and that's become it's hard for me to believe that just a few years ago all we did was just outsource translations without even really thinking through the implications of how all that affected our work as a patient recruitment firm. So we've seen tremendous advances in expertise and knowledge. I actually personally do quite a number of trainings, and just returned from doing trainings in China and Singapore, and around the world, even in the US, we find that sites tell us that they are open and interested in working with recruitment services, but they still know very little about how to really engage. And so it's the site, it's the sponsor, the CRO, the recruitment firm, and how do we all join together to help broaden the site's ability to use these sophisticated services. And I think that's through onboarding, through what we would call onboarding of education and training programs. Sites tell us 100% of sites that we survey in the last year tell us that they want to know more about how they can get more engaged with the recruitment provider, have more interaction with them, have more interaction with the CRAs around enrollment, and then just learn how to use basic recruitment materials, even in the US. So I think by having an open-minded approach and perhaps being more assertive about how they might engage with the recruitment provider would provide a lot of new opportunity.
RxTI Talks is brought to you by the Rx Trials Institute. Thank you for watching. Join us for more episodes, each highlighting some of clinical research's most innovative companies and individuals. Looking for more great thinking? Join the conversation at the Site Solutions Summit this October at the PGA National Resort in Palm Beach Gardens. Proudly hosted by the Rx Trials Institute. This year's summit brings together more sites, sponsors, and CROs than ever before. Visit www.sitesolutionsummit.com and register today before the seats sell out.